should reach about 5%. So we're talking
Yes,
about 1.3 million. So 5% of that ought to be tested, and there needs to be a scheduling of that, because 1.3 million will be about 65,000 needed to be tested, Your Honor. So we need to
Secretary Duque, I'm more interested na may pondo para pambayad po dyan. I think we both agree na importante yung epidemiological surveillance para nakikita natin as we open our economy, alam natin na hindi magkakaroon ng widespread transmission kagaya ng mga nangyari nitong mga nakaraang linggo. Ang point ko is may pondo ba tayo? Because if I'm not mistaken, less than 7 billion yung nagastos for testing. Ang budget is about 22 billion, so roughly about 15 billion pa yung natitira. And may bayanihan 2 coming, may 10 billion na inilaan para din po doon. So do you agree with me na may pondo naman talaga?
Meron naman yung pondo, kailangan lang pong planuhin at saka yung program nito para maayos ang implementation. Pag-aaralan po namin kung ito ay nakasama po. Kasi yung pong testing plan ng gobyerno ngayon patungkol sa ito po yung expanded testing program ng gobyerno. At baka naman nakasama na ho. Hindi ko lang dala-dala kasi yung 8 subgroups that when ito yung mga tao.
Hi, Maan. Can you hear us, studio? Yes, ma'am. Good afternoon, I'm Sean Yao and this is One News Now. At least 20 aftershocks were felt in southern Luzon after a magnitude 6.6 earthquake rocked Masbate earlier today. Some quake victims in the town of Kataigan are still struggling to find shelter as their evacuation centers are full of locally stranded individuals or LSIs. Jenny Dongon with the full story.
For Alma, the safety of her 2-month-old baby is more important than anything else. That's why when her town in Masbate was struck by a magnitude 6.6 earthquake on Tuesday morning, she immediately used her body to protect her baby. The strong tremor lasted for almost a minute, but it was soon followed by at least 20 aftershocks.
Dinapaan ko lang yung anak ko. Siya yung tinakpan ko. Yung isa doon sa ilalim ng lamisa, nagtago. Sobrang lakas talaga, ma'am, para kaming dumudyan lahat eh. Nahilo talaga kami lahat. Yung anak ko nga nanginginig eh.
Several buildings and houses collapsed in Kataigan, where the epicenter was located. Mayor Felipe Cabatana says one of his constituents died from the quake. He's a retired police colonel who was trapped in his house. More than 50% of the houses in the town were partially damaged, while major roads suffered from large cracks brought about by the earthquake. Residents were advised to put up temporary shelters in the streets or parks, as evacuation centers are still being occupied by over 100 locally stranded individuals. 6 of these LSIs have tested positive for COVID-19.
Ang proposal namin sa DOH na yung mga LSI ihatid na lang sa kanilang barangay pero i-quarantine sa barangay hall. Kaya lang ang DOH ayaw dahil ang monitoring sa LSI medyo mahihirapan yung municipal health officer.
Meanwhile, PHIVOLCS Director Renato Suridum said that while the magnitude 6.6 quake was a strong one, it's unlikely that it will cause a tsunami.
Ang fault po ay kumilos ng pahalang. Ang fault po na pahalang ang kilos, hindi niya masyadong madidisturb ng tubig kung nasa dagat yung movement niya.
Intensity 7 tremor was reported in the town of Cataingan, while Intensity 4 was reported in the town of Mapanas in northern Samar, Legazpi City in Albay, and Leso in Aklan. Intensity 3, on the other hand, was reported in the town of Iloilo, and Intensity 1 was felt in President Roxas in Capiz. Presidential spokesperson Harry Roque assured quake victims that relief efforts are in place. He added that President Duterte in fact wants to visit the communities affected by the tremors.
Instinctively, ang presidente gusto nang lumipad papunta ng Masbate. Pero whether or not he will be allowed, tignan po natin.
For News 5, Jenny Dongon, We Are One News.
Meanwhile, the Taal volcano emitted steam this morning. Plumes as high as 20 meters were seen from the volcano's main crater. PHIVOLCS recorded at least 5 volcanic quakes around Taal since Monday. However, the agency clarifies that Taal volcano is still under alert level 1. What this means is that going to the volcano island is still prohibited. President Duterte once again put Metro Manila under General Community Quarantine or GCQ starting tomorrow, August 19, until the end of the month. Aside from NCR, the provinces of Bulacan, Cavite, Laguna, Rizal, Batangas, Quezon, and Nueva Ecija will be under GCQ. Same goes for Iloilo City, Cebu City, Lapu-Lapu City, Mandaue City, Talisay City, and the municipalities of Minglanilla and Consolacion in Cebu. More businesses will be allowed to operate and open in these areas. Public transportation and dine-in services will also be allowed, provided that minimum health standards are observed. However, presidential spokesperson Harry Roque announced earlier that gyms and internet cafes will remain closed in GCQ areas. And the group of health professionals that previously called for a timeout expressed satisfaction with the 2-week MECQ in Metro Manila and nearby provinces. News 5's Marian Enriquez joins us live from Manila to tell us more. Marian, exactly what developments did they observe during the MECQ and what makes them say that they were satisfied?
Sean, on a scale of 1 to 10, a group of health professionals gave the government a score of 8 for the developments that transpired during the 2-week MECQ lockdown. But the UP Octa research team said that the 2-week lockdown should have been extended to prevent the increase of COVID-19 cases in the country. The Health Professionals Alliance Against COVID-19 was pretty much satisfied with the outcome of their meetings with the Health Department and the National Task Force Against COVID-19 during the 2-week MECQ lockdown. The group, which is composed of more than 160 health professional organizations, was the one that previously called for a timeout to reorganize the strategy in responding to the pandemic. For Dr. Anthony Dans, president of the Philippine Society of General Internal Medicine, the timeout resulted in fruitful discussions and new plans. Dr. Maria Carmela Casala of Philippine Society for Allergy, Asthma, and Immunology echoed Dr. Dan's sentiments. The doctors welcomed the launching of the One Hospital Command Center, which aims to improve the health facility referral in NCR. They proposed for an expansion of the One Hospital Command to the One COVID Referral Network to cover clinics, pharmacies, laboratories, and other services. Doctors also urged government entities to strengthen the role of science in their decision-making processes. Through the Health Technology Assessment Council, or the HTAC. The HTAC aims to study over 58,000 COVID-19 studies to help policymakers. The council should be consulted on the right medicines, vaccines, and tests, among others. Doctors are also pushing for internet connectivity for all, especially for those who are living in disadvantaged areas, for a more efficient contact tracing and telemedicine. They're also asking for safe, sufficient, and sustainable transport option for the poor, on top of an enforcement of workplace safety guidelines by the Labor Department. But not all doctors are satisfied with the 2-week MECQ. Dr. Guido David of the research team noted that the countries are not, or the number that represents the infectivity rate of COVID-19 in the country is currently at 1.1. This is a huge reduction within 2 weeks compared to the previous 1.5. Sean, experts are reminding the public to practice religious washing of hands, wearing a face mask, and a physical distancing. They said that with the new interventions, experts are optimistic that this will help the country to manage the pandemic better. Sean?
Thank you very much for that update. Marian Enriquez reporting to us live from Manila. The Health Department reports over 4,000 additional COVID-19 cases today. And this brings total infections to more than 169,000. Active cases are now at 53,000 and most of the new cases were recorded in Metro Manila. The death toll now stands at 2,687 with the addition of 7 new deaths. Over 180 recoveries were also reported today, bringing the total number of COVID-19 survivors in the country to over 112,000. We'll have more stories after a quick break. Keep it here on One News. You are still watching One News. I'm Sean Yao. Despite being on quarantine, Health Secretary Francisco Duque III still became the subject of today's grilling in the Senate. Now, he's being accused of coddling the so-called mafia in the agency. Mayan Los Baños with the story.
If there is any truth to allegations that a mafia is operating within PhilHealth, a whistleblower says Health Secretary Francisco Duque can be considered its godfather. The Senate conducted its third hearing on irregularities in PhilHealth today with Duque in the hot seat.
May tuturing ko po na siya po yung godfather po ng mafia. So ang dahilan po na meron po siyang command responsibility at halos ma'am lahat po ng mga members ng mafia ma'am ay mga halos siya po yung nag-approve ng appointments nila ma'am.
I deny this, absolutely malicious and without basis. I do not wish to dignify that allegation.
Dennis Adre, one of the agency's regional vice presidents, also pointed to PhilHealth Executive Committee members as the so-called mafia.
If we are to be called mafia for questioning flawed policies and illegal orders for exposing irregularities, then so be it. But we are the good mafia, and they are the real and bad mafia.
Adre said they were punished left and right with suspension and reassignment for exposing the irregularities in PhilHealth. He said Duque, who is the chairman of the board, was well aware of the situation. But amid the allegations thrown his way, Duque enumerated the actions he took to fight fraud inside the agency. Duque has been a part of PhilHealth in the last 18 years, sitting as president, chairman, or member of the board.
And I would like to state for the record that I am for zero tolerance on fraud and corruption.
Duque also refuted claims that the agency incurred a 154 billion peso loss due to fraud and more than 102 billion pesos for overpayments. He also defended the agency's use of the Interim Reimbursement Mechanism or IRM, saying funds are not solely intended for COVID-19 patients.
And COVID patients are not the only casualties in this war. IRM funds are not exclusive to hospitals catering to COVID-19 patients. It is for all HCIs catering for all patients during this pandemic.
But Senator Ping Lacson questioned PhilHealth's release of money to dialysis centers and maternity clinics.
Regular benefit claims yung sinasabi ninyo na hindi tatama dito sa circular na pinalabas para sa fortuitous event. O sabihin na natin para sa COVID-19. Yung sinasabi yung dialysis, hindi naman natin inaalis na tulungan din. Pero sa ibang programa, hindi po dito sa 0007 na IRM. Tama po ba yun?
Tama po kayo, Your Honor. We will rectify.
Duque then conceded to Senate questioning and admitted that cash advance payments made to dialysis centers and the like constitute illegal activity.
Illegal po yung pagbigay ng bayad sa Bipron Abidum na hindi naman nagkikater sa mga COVID-19 patients.
Yes, Your Honor. I take note.
Pag illegal, may malversation. Kasi hindi pa tungkol sa tamang dapat paggamitan ng pera. Tama po ba yun?
Tama po kayo, Your Honor.
Asked if he will heed the call of the senators for him to resign, Duque only said he did his best to respond to the COVID-19 crisis. PhilHealth President Ricardo Morales failed to attend today's hearing since he is on medical leave. Executive Vice President Arnel De Jesus also had medical check-up. Reporting for News 5 Mean Los Baños, we are One News.
For more updates, follow News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Sean Yao. We are One News.
During the board meeting, nung diniscuss po yung paggamit nitong